partial knee replacement is an operation where we only replace part of the knee as opposed to a total knee. Typically it's on the inside portion of the knee. Sometimes it can be the kneecap area, sometimes it can be the outside portion of the knee. I think the main difference between a total knee and a partial knee is that the partial knee patients tend to have a more natural feeling knee than the total knee does. The problem is that not many patients are good candidates for partial knee replacement, and it takes an experienced surgeon to determine whether the patient would be better off with a total knee replacement or the partial. And that depends on the individual patient, the activity level that patient wants to get back to, and the disease process in each individual patient has to be very well understood before making a decision one way or the other.